Hi, my name is Dr. Bethany Murray, and I'm going to talk with you today about some learning activities that I have found helpful in my nursing pharmacology class. So, Nursing B261 is a very large 4 credit hour course that's delivered once a week to sophomore level students, and we have about 60 students in each class. Some of the challenges of this course is the large amount of content that must be absorbed for students who have yet to enter into any clinical or practice areas. We also meet just once a week for 4 hours, which is a lot of time in the seat. Many of our faculty are specialists in their field and don't really generalize in pharmacology overall. And also, it is a challenge for the early nursing student who's trying to learn medical terminology that might also be learning English as a second language. So when you look at the literature, students have reported that they learn best in science courses like pharmacology when the material is broken down into smaller chunks and is taught by category or classification. Case studies, simulations, group work, and a diversity in approaches seems to work best. What I decided to do was break this long 4 hour lecture into 4 distinct 50-minute segments. Each segment starts off with objectives and then about 30 minutes of content. Then we do some kind of a learning activity or review activity. And then I like to intersperse what I call brain breaks, which is something physical. So I may randomly have the students stand up and dance to the Macarena for 3 minutes. Or I have a beach ball with some exercises written on it, and I'll throw that across the room, and we'll randomly have to do some physical exercises next to the classroom. This actually generates not just energy for the students and myself, but also some laughter and kind of just helps to break the class period up for us. So the first activity I wanted to talk with you is something I call zombie pharmacology. This is a case-based learning. What I've done is developed a mythical drug which prevents a person from turning into a zombie if they become bitten by a zombie. So we talk through the process of drug development, pharmacodynamics, pharmacokinetics, safety issues, and then I pose knowledge-based questions to the students, often using something like Top Hat, and then we'll end our 20 to 30-minute discussion with some kind of an ethical dilemma, like given what you know about this drug, would you feel comfortable in giving it to a pregnant woman or a woman who is breastfeeding? The second thing I like to do is a unit exam review, which I call a popcorn quiz. To get ready for the popcorn quiz, I have gone to Sam's Club and purchased mini bags of Smart Pop popcorn. I then print out all of the students' names and place them in a bowl. I have created 40 questions that mirror the unit exam that will come in the following week. Then I'll pull a student's name out of the bowl and ask them a question. The student can answer the question and I will throw them a bag of popcorn. Or if they're not sure, they can pop the question to a classmate and the classmate then gets to answer it and receive the popcorn. But never fear, by the end of class, everybody has the opportunity to take home a bag of popcorn. So if your name is not drawn from the bowl, or if you passed the question, you still get to take home a treat. And then the third activity I want to discuss is a cardiovascular escape room. This is a group learning activity in which I have given a group of students a challenge using Canvas quizzes. They must treat the cardiovascular patient, Mr. Bruce Banner, before he hulks out and passes away of heart disease. So they have 30 minutes set on a timer in the room and in which to get 100% accuracy on the cardiovascular quiz. If they cannot achieve 100%, they have to go back and do it again. And to increase the sense of realism, I put yellow caution tape on the classroom doors so the students are told that they cannot leave until they have saved Mr. Banner's life. So these have been very well received by students. They say they really like the group quizzes, they like the popcorn review, they feel engaged and motivated, they like all the different learning styles. My course evaluations last spring averaged 4.70, and that compares to a program mean of 4.22, which is a positive outcome. So these are the references that I used when doing the literature review and planning my class. And if you would like to have ask further questions or discuss this, please come to the Q&A session for the quick hit presentations at 1 o'clock today. And also, this is my contact information if you'd like to contact me. Thank you for your attention.